Hello everyone. Breast cancer is a very unfortunate condition. Fighting cancer and losing an organ in the process can lead to unimaginable mental stress. Amid such stress, the last thing one needs is sympathetic comments from others, constantly reminding them about their implant and prosthesis. Prayasta is looking to ensure one-to-one personalization according to the woman's body, structure, size, and shape, and ensures that implant is closest to the natural organ. Today, we have Dr. Jayanti Thumsi, who is currently working as a lead surgeon breast oncology at Apollo Hospital, Banerghatta Road, Bangalore. Dr. Thumsi has graduated and completed her MS in general surgery from Grant Medical College, JJ Hospital, Mumbai. She has undergone training in breast oncology at Tata Memorial Hospital in Mumbai. She has been practicing breast oncology in Bangalore for 21 years and has vast experience. She has performed more than 3,500 breast surgeries and 2,500 other surgeries so far. With an expertise in breast conservation and breast reconstruction surgeries, she has keen interest in bringing about awareness in women about breast cancer and has been very active in conducting more than 258 awareness programs and has educated 4,58,000 women so far. She has done a number of TV shows, radio programs, written newspaper articles, YouTube videos, Facebook live programs, etc. She has authored a book, Lump to Laughter, which highlights the emotional journey of women going through breast cancer treatment with medically validated information. This book is already in its third edition. She has been honored with Women Achiever of Karnataka 2019 by VRL Group, Vijayvani and Digvijay TV, Kengal Hanumantiya State Award 2019 for her work in the field of breast oncology and her contribution to the society, Chanakya National Award, Jury Special Award for Medical Inspiration by the Public Relation Council of India and World Communicators Council on the 6th March 2020. She is the founder member and managing director of CREST Foundation, which is an NGO working on reducing the burden of cancer in our society. Under her leadership, CREST Foundation has collaborated and organized the world's largest campaign for breast self-examination, in which 2,332 women were taught breast self-examination in a single day. This event has a world record and has been recognized by Limca Book of Records. Crest Foundation has sponsored education for three deserving, meritorious, but underprivileged students for completing MBBS. Dr. Jayanti has published many papers in various national and international journals. She has been an invited speaker in many national and international conferences. She is also involved in many active research activities and clinical trials. We welcome you, ma'am, and thank you for sparing some time.
Thank you so much. And hello, everybody. It's a pleasure for me to talk to all of you and share some of my views. Thank you so much.
And we are very honored that during the month of breast awareness month, you have volunteered to speak with us on our channel. And at the same time, ma'am, your contribution to the society is very relevant for our talk today. Thank you, ma'am, once again. So, ma'am, I'll begin with a very generic question. How did you decide to be a doctor, and that too in an oncology, ma'am, specializing in that area?
Yeah, so well, that I should become a doctor has been my dream ever since I was a child. Since I was 3 or 4 years, I remember. We were, as a child, I think I was in third class, we were asked to give a speech. There was elocution competition on aim in your life. I remember very well. And even at that age, I had said that I want to become a doctor. Now, why at that tender age somebody thought of it, I have no clue. We have no doctors in my family. I'm the first doctor. Well, I think it's just that we are born in one particular way or wired, and some external influences help us. But I was very clear that I wanted to be a doctor, and luckily, by God's grace and everything, I could do that. Well, but why did I choose oncology? Is an interesting story. I lost my father because of pancreatic cancer.
Oh,
And during those days, there was not so much of advancement as it is available now. There were not so many hospitals. I'm basically from Mumbai, and we took him to certain hospital there. And the way he was treated, it kind of hurt me very badly. The way I was spoken to, it hurt me very badly. Probably that particular doctor had a bad day or whatever, I don't know. But the way it was communicated to us, it was very sad, and I can never ever forget that day in my life. I was doing my second MBBS, and as a second MBBS student, you have no idea about oncology. You're just doing studying. So that's the day I decided that I will become an oncologist, and I learned what not to do um, in that circumstance. And I think my father's illness, yeah, drove me to do oncology. And being a female, women with breast cancer felt comfortable to come to me, because they like to go to a lady doctor to get their private part examined, and that's how I chose breast oncology.
ma'am, it's a very interesting journey, and I'm really sorry to hear about your father and your loss. I can very well imagine and understand. Ma'am, so going forward, how would you define and what is the breast cancer, ma'am, for the general public, if you could make them aware?
Right. So cancer in a body it happens when there are some genetic changes that happen in our body. Now, these genetic changes can be either inherited, that is, it runs in the family from one generation to another generation, and particular person may be born with a faulty gene, which later on in life shows up as cancer. So this accounts to about 5 to 10% of cancers. That means 90% of the people who develop cancer have no family history, but certain genetic changes happen in that particular life. All right. Now, talking about cancer, each cell has a cell cycle. The cells in our body are produced like a factory every day, every few hours. The cells are being replaced by newer cells, and the older cells are perish, and they become and new cells take its place. The factory where these cells are produced is called bone marrow. Within the bone, there is a marrow, that is where the cells are produced. Now, a cell is born, it increases in size, it becomes bigger, it becomes matured, it performs its function.
Mhm.
And after it performs its function, it also dies. This is a normal cell cycle. But sometimes things go wrong, and when it reproduces, it replicates without control. Or some of the cells do not perish at all, they do not die at all. They become immortal, and these cells keep growing. One becomes two becomes four, and four becomes multiplied like that in no time, because the control to stop the growth or control to stop it from being immortal is lost because of certain genetic changes that can happen. And that is when such a cell is called cancer cell. If such a cell is in breast, it is called breast cancer. If it is in the brain, it's a brain tumor, and so on and so forth. So, yeah.
So, ma'am, I had a following question to it. What causes breast cancer? But I think you've explained it quite well in your answer. So I would skip that, or else, ma'am, do you have any further details to give, like what
Yeah, no,
exactly?
yes. So there are some women who are at a higher risk of developing breast cancer. All right. So who are these women? Now, the basic function of breast is to secrete milk and to nourish a child, and that's why it's a well-developed organ in a woman. However, there is breast tissue also in the men. Hence, we see breast cancer also occurring in men and also in women. Now, for some reason, if a woman is not able to perform this function of breastfeeding, if breastfeeding does not happen, that is one of the high risk factors. Like women who do not get married, or get married but do not have children, or have children but they are unable to breastfeed. Such women are at a higher risk. So we always recommend that please breastfeed your babies for as long as possible, at least for 1 year, because it is protection for the mother against breast cancer.
Okay.
Second is when the first child occurs after the age of 30 years, that is again a high risk factor. Obesity, smoking, alcohol again raises the risk of developing breast cancer. And of course, taking indiscreet use of the hormone tablets, like say oral contraceptive pills for very, very long time, or empty pills, eye pill, postponement tablets, which are very common in our country. And unfortunately, without even a prescription, one can go and buy it in pharmacy. So I would recommend, please don't do that. Without a prescription from a doctor, go and see a doctor and let the doctor decide what is good for you, what is safe for you. And of course, 5 to 10% of breast cancer can run in the family, where it is when a person has inherited a faulty gene, which is transmitted from one generation to another. It can come from your paternal side or maternal side. And but now we have genetic tests available, where we can, women who have a strong family history, we can actually detect whether there is any risk for that particular lady. And if there is a risk, corrective actions can be taken. I'm sure we all know Angelina Jolie's story. Such a thing can be done in India. It is available in India. It is available at affordable cost. So people who have strong family history, you can avail that kind of a facility.
And that's a very good information that you gave, especially I'm sure people who are of the younger age are listening to you and would also understand that taking off the counter pills unnecessarily is not required, and be it for any reason. That's a very good point that you made. And of course, giving an example of Angelina, I'm sure people can relate to it and can understand that how important it is. Thank you, ma'am, for that. So, ma'am, what age do you recommend for women to start screening themselves?
Right. So screening basically means screening is done by women who are enjoying good health right now. They have normal health. They have no breast cancer at this point of time. But you are taking certain actions before the disease becomes big enough to become symptomatic. Okay, so that is called as breast screening. All right, so it has to be done by all women who are normal right now, who are disease free right now. So it is recommended that so in breast screening there are basically three things. One is breast self examination, second is clinical breast examination, and third is mammogram. All right. Now, breast self-examination, we recommend that all women 20 years and above, please do breast self-examination once in a month. It's a very, very easy step. It takes less than 5 minutes. All that you have to do is spare 5 minutes of your time in the entire month. All right. There are many videos on YouTube. Just type breast self-examination, a lot of videos will come up and you can learn how to do it. It's a very simple method, and all women 20 years and above, once a month, breast self-examination. Now, clinical breast examination is when you go to a doctor and the doctor examines you. So women who are 20 to 40 years, I would recommend that once in 3 years, even if you do not have a problem, get your breast examined. There can be many things in the breast which are not symptomatic right now, but it doesn't mean that all is well. So once in 3 years, women 20 to 40 years, go to a doctor and get yourself examined. However, women who are 40 years and above, I would recommend that along with breast self-examination once in a month, please do a mammogram once in a year. Mammogram is a special kind of X-ray we do of the breast, which is not recommended as a routine for women who are less than 40 years of age. But starting from 40, get a mammogram done once in a year. With the mammogram films, go to a doctor and get your breast examined once in a year. Mammogram is extremely, extremely important, dear friends, because it can pick up an abnormality in the breast when it could be so small, so tiny, few millimeters, that it is not even felt by the fingers, right?
Mhm.
So at such a stage, if we can detect an abnormality, the chances of cure are extremely, extremely high, and the woman can enjoy normal life and good health in spite of developing breast cancer. So these are
True.
the screening guidelines. Yeah.
Thank you, ma'am, for the information. Ma'am, since you are an oncologist, what are the various options for surgery that a woman has if she
Yeah,
is going through a breast surgery at that time?
exactly. Now, yeah, so I have, in my experience, I've seen and I feel that breast cancer is not only a scientific issue. It is
Mhm.
actually a emotional issue. It is a social issue, and there can be a lot of psychological issues associated with it. And that's why there is so much talk about breast cancer in general, so much research happening, because it can impact a life quite a bit. No, breast is a sign of femininity, for a woman,
Mm.
right? And I've seen that in our country, a lot of women come to the doctor when the disease is already in an advanced stage,
Mhm.
which is unlike what happens in the developed countries, in the Western countries, where women usually go at a very early stage because they are aware. And one of the myths associated with breast cancer is that there are women who notice a lump in the breast. They suspect that it could be cancerous, yet they don't want to go to a doctor because they have a fear that if I get breast cancer, my breast will be removed
Yeah.
and I will lose my womanhood, I will lose my femininity, and life will not be worth living, you know.
Mm.
And especially, I've seen this in young patients. Breast cancer in young is quite common in our country. According to the statistics, about 48% of women develop breast cancer in our country when they are premenopausal. When they are still menstruating, they've not even reached menopause, and they develop this disease. And quite a few of them develop in their 20s and 30s, when body image is an issue, and that certainly needs to be addressed. So in surgery we have options. Yes, mastectomy has been traditionally done for many years, but now if we can detect the disease early and in certain conditions, we can do what is called as breast conservation surgery, where we do not remove the whole breast, we remove only the abnormality and try to give a good cosmetic outcome as well. So the
Mhm.
focus has changed from radical surgeries to a surgery where cancer is cleared, and at the same time, the femininity of the woman is retained, so that the quality of life post cancer treatment is also ensured. So that is where breast conservation surgery or breast reconstruction surgeries come into play. And let me tell you, dear friends, these are very safe surgeries and very commonly done and also affordable. Don't please have that notion in your mind that it is meant only for super rich people or something
Mhm.
like that. No, reconstruction is quite affordable now. And everybody, woman who goes through this, should avail that and enjoy a good quality of life, because the advancement in treatment has been so much that most of the patients survive breast cancer. So looking at giving a good quality of life is equally important. So in reconstruction, we have two types of reconstruction. One is using an implant based reconstruction, or second is autologous reconstruction, wherein we use patient's own tissue, maybe muscle and fat and skin from another site,
Mhm.
and we use that and create an artificial breast for that particular lady. Yeah.
Oh, that's very good information, ma'am. Ma'am, as a doctor, do you also influence, or influence a decision of buying a prosthesis or an implant with the patient, or how does your role come in the picture, ma'am, after the
Yeah,
surgery is done?
yeah. So we discuss everything with the patient, and the treatment is planned as a team with the patient, their family members, and the medical fraternity. Okay, so it's as a team the decision is taken. Is that what the question was?
Yes, ma'am.
That yes, we do recommend, we do give them the pros and cons, the advantages, disadvantages of each procedure, and make them understand, and only then a collective decision is taken.
Ma'am, there is a myth with a lot of patients, or rather, I would say, not a myth exactly, a mindset. Uh, I was speaking also with a couple of other doctors who ended up saying that once the implant is placed as an order for a patient, and then when it is open in the surgery, there is a fear that the implant size may come, may not match with the order that was placed. Hence, there is a surgery done on the healthy side of the breast to avoid a later surgery probably, and match the implant side of the breast. How many times does that happen, and does that really hamper women from going into implants?
That's a very good question that you've asked. So you should understand that we are putting implant in one side of the breast and the other side of the breast is healthy. All right. Now, a healthy breast, as a woman ages or as she goes through the physiological events in her life, like having a child, breastfeeding, menopause, etc., the breast starts sagging. That's a natural process. It is not taught. It doesn't remain taught as we see in teenage girls or younger girls. As a woman ages, the breast starts sagging.
Mhm.
So the one with implant will not sag, but the other one sags. All right. So that there will be a little difference in size. A woman either has to accept, or another thing we can do is do a surgery also for the opposite side to match it with the side where the implant has been placed.
Mhm.
This kind of a surgery is very, very common in the West. Okay, it's very common in the West, where even on a healthy breast, a surgery is done to match it. But I have seen that in India, not many people opt for it because they don't want unnecessary surgery for another breast. And but I feel that there are very good bras available now. Where with the help of that, you can externally at least match it. Though within yourself there will be little difference, because sagging is something which we cannot prevent.
Yes, change, yes. So, ma'am, if like you're aware that we at Prayasta are making personalized breast implants and prostheses, will this really help these survivors to, take the option that is available, not only because of cosmetic purpose, but of course because of medical reasons also, because our prostheses or implants are leak proof, are suturable, can be weight balanced, and we are also trying to give the natural touch and feel, and are trying to restore the body perfectly. Do you think that this will really benefit?
Oh, I'm sure it will benefit, because that is the gap right now that we are having, where there is just one size, or maybe 3 or 4 varieties of implants, and in prosthesis there is hardly any choice available. Few kinds of implants which are there, and we have to make do with what we have. But if it can be customized, if it can be individualized, matching the opposite breast, I think that will bridge the gap which is there right now.
Yes, and ma'am, I also feel that it will bring back the confidence in those
Yes.
survivors, like before the onset of the breast cancer, because I realize that they do not want unnecessary sympathies from anybody else. Yeah,
I
that's a
agree with you. And yes, like I said, it's a very, very emotional issue. And women, especially working women, or even otherwise,
yeah.
they do hesitate. And certain activities they restrict themselves from doing. Like I said, wearing a t-shirt or wearing a swimsuit or anything like that, they do restrict themselves. and somewhere it hampers the quality of life. And if something like this comes into use, it will be a big bonus for the confidence of the women.
Yes, I'm sure, ma'am. Thank you so much. Ma'am, any parting thoughts that you want to give right now?
So I would like to say that one need not fear the word breast cancer. Okay, breast cancer is not end of life. All right, it can strike anybody. It can happen at any age. So being aware about it is extremely important. Please do breast self-examination once in a month, as I suggested, and do a clinical breast examination. Go to a doctor periodically and get yourself examined. All women 40 years and above, please do a mammogram. The game changer as far as breast cancer is concerned is early detection. Early detection and appropriate treatment can save lives. And for whatever issues you think are there, there is a solution right now. Okay, so cancer can be cured, breast cancer can be cured, and also femininity of the woman can be left intact. So equal emphasis is given on quality of life, and normal life after breast cancer treatment is possible. Right.
Thank you so
very
much. Thank you so much for your time, ma'am, and thank you for lovely insights that you gave us. I'm sure this is going to really help a lot of people who would listen to you. And once again, ma'am, thank you for your time.
Thank you very much. I enjoyed speaking as well. Thank you.
Same here, ma'am. Thank you. Bye, ma'am.
Bye.